Welcome, everyone, back to another edition of Disruptive Dental Science. My name is Dr. Ashton Prince, and I get to be your host tonight. I am one of the clinical ambassadors with Dental Advisor, and I am joined tonight by my good friend, Dr. Adam Hodges. Dr. Hodges, nice to have you tonight.
Ashton, hey, thanks for asking me to come on tonight. I really appreciate it, and I'm looking forward to it.
Oh, absolutely. It is excellent to see you again, my friend. Uh, Dr. Hodges and I, we refer back and forth to each other with first names. So, Adam, it's something that you and I have kind of been messing around with a little bit. Something that I know that you've got a bit of a passion about when it comes to anything in the dental field that we have. We're starting to develop uh, into a different realm of how we actually do dentistry. A topic that Adam and I have been discussing recently is that of 3D printing and where it's going, what it has become so far. And so what I'd really like for you to do is kind of tell us what your current thoughts are on it, what your history has been, because I know you've got quite the history. So what if you wouldn't mind, kind of tell people who you are and why this has become a passion for you.
So yeah, I'm Adam Hodges. I'm a generalist in Asheville, North Carolina. Went to school to dental school in Georgia and residency in South Carolina, and then came up to Asheville to join my father. And now my brother and I practice together. Um, so I was really fortunate early in my career because I got involved with a lot of really high end dentists in my residency, and they really um, inspired a passion in me to learn more about dentistry. I found
Nice.
them to be the kind of dentist I wanted to be, so I wanted to emulate them. And so that's kind of been my journey, is trying to figure out how to be a better dentist. And I went through things like Pankey and Spear, like a lot of people, but I was fortunate to
Sure.
do it early so I could put those tools in my tool chest and kind of get going. And then as I've evolved, I get into a lot of things, and I do enjoy dentistry. It's my hobby as well as my passion. So as I looked at this in 2017, I decided I'm going to get into 3D printing. I'm going to buy the Form 2 printer. It just come out from Form Labs, and I thought, you know what? I'm going to get this thing, and I'm going to be a 3D printing dentist. So I bought it, stuck it on the counter. It looked very beautiful when I took it out, but I didn't know anything about 3D printing. I didn't even understand it. So I took it out, I looked at it, and I said, I'm not sure how this thing works. And so I made my very first print on this printer I bought in 2017 and 2024. And the reason I did is because I bought a new scanner, and I decided once again to kind of reinvigorate that passion. And part of the challenge was in 2017, if you were going to 3D print, you had to buy a printer, but then you had to sort of create a way to post process it. And that way was you had to get something to wash it in, which is isopropyl alcohol. And then I was
Hmm.
going to use a gel nail curing device to post process it and light cure it, which is it was such a weird thing. I was thinking, this can't be the way I'm going to do this. So by the time it comes full circle, and in 2024, I'm looking at this machine. I'm like, I really want to do this. I never did. So I took a little deeper dive, and I got involved with what really has to happen to make this work in my practice. And so I decided when I bought a new scanner that I'd buy a printer. And then actually since then I've been so enthused with it, I bought another printer, and have really kind of gone off and running. So it's been a really great journey thus far.
Well, I'm going to stick you to it here for a second. Can you tell us what printers it is that you actually have got, or what's the new one?
Sure. So one of the challenges that for me, and I mean, there's a lot of great printers out there. So when I talk about what I use, it's probably not necessarily the best printer, but what I learned about printing was there's a few different ways to print. There's an SLA way, which uses a laser, and typically those have
Right.
been maybe a little more accurate, but a little slower. And then they've got printers that are using light. And some of them they use DLP, light
Right.
projection, kind of like a movie theater projector that prints a layer, or even LED or LCD is another type. But the reality of these printers is that what I wanted was a little more speed. It seemingly was going to take a little while to use the SLA printer. So I bought the Sprint Ray setup. And the nice thing that for me is when I made that purchase, I could buy an architecture. So
Yeah.
what I wanted was a start to finish way to print, clean, and then post process all in one house. And that just made it a lot simpler. And there's several people who have an architecture like that, but I just decided Sprint Ray because they had dedicated themselves to dentistry, and it was just seemed to resonate a little more with me.
No. So it's funny that we're even bringing this up in the first place. So I just registered for the DS World that's come up in Vegas here in a couple of weeks, and I noticed that the a lot of the classes that are being taught are actually discussing 3D printing, what it has been, what it's becoming, and everything else to it. And I found it interesting that we're still dealing with this because it's still kind of on the edge of what's really coming about. So there's a number of items that a 3D printer can be used for. What do you use yours for?
Sure. Man, that's a great question. And that probably is the basic question of figuring out whether you need or want a 3D printer. But the reality of 3D printing is sort of like computing, which is a 3D printer is no different than a printer you have in your office to print a treatment plan or a picture or whatever.
Sure.
The reality is that you have to get data. In this case, you're getting data from a scanner, usually a digital scanner, and then you have to manipulate that data. That would be the equivalent of a Photoshop. You've got to take this data and create something with it, and then you can send it to the printer to be printed. So the real pain point for that is the design element. So for me personally, what I knew I wanted to do is I had kind of a vision. We place implants, and I wanted to place all my implants guided. While I know I can do it by hand, and a lot of people can do it very successfully by hand, what I knew was that I would get better accuracy if I did it with a guided approach. So for me, I wanted to have guided surgery. I wanted to have night guards, and then I was really interested in where we were headed with materials you can put in the mouth that were crown-based materials and where that journey is going. And
Yeah,
we're still probably pretty early in that journey, but I wanted to get on board with that.
makes sense. So the kick to me, whenever we're talking about new advancements, new technology, everything else to it, there's got to be some type of a reason as to why it is that we're actually getting into something like this. So, what was it that took you from the traditional way that you had been doing things to saying, I've got to improve? Was there something that was within 3D printing? You're like, that is what I have to have in my office to be able, was it just efficiency? Was it the need to be on the cutting edge? Was it a patient experience? I mean, what was it that actually said this 3D printing is exactly the direction that this needs to go?
Yeah, that's a good question. I think that the reality for me was while 3D printing is kind of considered the cutting edge on the outside world, we know it's been in dentistry for a little while. I think the biggest thing was I was like, let's say night guards, for example, my workflow was I would take upper and lower impressions. I would take a centric relation record. I would mount that case and index the model, send it to the lab who would print a 3D night guard, send it back to me. I would remount it, re-equilibrate it, and then put it in the mouth. And I said, the only piece I'm missing here is the printing of the night guard and the manufacturing. I said, this
Sure.
isn't the hardest piece. So I figured, well, that's one thing that I can do with it. And so that was part of it, is just to be able to control. Part of it's controlling the process, because I really wanted to have outcomes and wanted to see how I could improve my outcomes. And the other part was, a lot of times for me, I'm maybe not the guy who plans ahead, months ahead for my cases. I'm trying to do things relatively last minute. So, like for example, the other day I had a surgery coming up, and I was going to place a couple of implants and section a bridge. And so the night before, I'm able to fabricate a surgical guide to be able to place implants exactly where I want them and have it ready that morning to do that. Or if I need to do a night guard overnight, and even with that patient who I ended up placing implants on, I section a bridge, I place some implants, and then she tells me she doesn't have a retainer. While she's there in the office, I print a model, make a retainer while she's waiting. So it's this ability to do things more efficiently, but yet with great quality. And as the materials are progressing, it's making it even easier and more predictable. So it's that ability to do things more efficiently for patients. And it is cool, but I think also I enjoy it. I enjoy learning and figuring these things out to be able to solve problems.
Sure. Well, a little bit of what we're talking about here then is also iOS of just doing some intraoral scanning and the experience that patients actually have, what they get to see, the wow factor that's actually associated with this as well. That happens with our patients all the time when they see something that is cutting edge. If you started doing, a night guard that is a short period of time, as opposed to taking your traditional impressions, sending them off to a lab, and maybe a week later, a week and a half, kind of depended on the lab that you were using to getting these things back. To have some of those now with some of these printers being able to be delivered within an hour or two. It's even shorter than that, from what I understand, is where things are actually going. Is that kind of what I understand? That it's becoming quicker. I mean, when we start talking SLA and DLPs and things, SLAS, it was a little slower, maybe a little more accurate, depending on which machine you're actually working with. DLPs are so much quicker with it though, and it's
Yeah.
becoming more and more, I'd say mainstream more so than anything else, right?
Yeah, I think so. I mean, I think the biggest thing is, so now they're making retainer materials. So all of these barriers for, hey, we've traditionally, let's say Invisalign, for example, they had to print models and then make the Invisalign uh, matrix on top of that. Now they're actually printing something so thin that it could be a retainer. So the next step is to potentially do that with a liner. So I think the limit keeps getting pushed further and further out. So as more and more people adopt this, we're seeing better and better materials. And let's think about crown materials for a second. So,
Yeah.
you know, 5 years ago, 7 years ago, we didn't have a crown material. We didn't even have something we can use in the mouth. Now we have things that we can use in the mouth. Now we have crown materials that were 100 and something megapascals. Who cares? That's not very strong, but it's as good as composite. But
Sure.
now in a year or two, now we're at 250, which is next year we're gonna have a material that has a 250 megapascal flexural strength. We're going to approach ceramic at a much faster rate than ceramic went forward. For those of us who've been doing it a long time, we've watched the Empress and the Empress Heiress and all the things that went through to become now what's Emax and Lissy Press and all the things we're using. But they're going to approach ceramic, and they're already working with printable ceramics. So, I mean, they're already working to try to figure that out. So a lot of these problems are going to probably be solved. And I just wanted to get into that architecture early. And it kind of depends on how much you want to nerd out. So the nice thing about that is if you want to nerd out, you can get really deep into it. Or if you just want to have a printer and have somebody else design it so you can print in your office, the nice thing about a printer is you can have somebody halfway across the world design something right now, and I can print it in my office and have it ready in 30 minutes. So that's the thing is, depending on however you want to get involved, you can. You can make it very simplistic, or you can make it as complex as you want. In dentistry, we love to make things complex. So that's part of what's going
Whether it's
on.
on purpose or not, we still do.
So in my office, I'm buying a design software, and I'm learning to be a lab tech. I bought ExoCAD, and I don't think going down the rabbit hole I'm going through is the smartest way to do this, but it's kind of fun, and I'm learning how to design things. And now I'm interfacing with lab techs better to understand their limitations. So I think it's actually strengthening my relationships with labs because I'm starting to understand their challenges.
So you and I, we both know each other to be kind of dental nerds. We love to see what's coming up next. We love to see how we can improve the things that we're doing. Let's talk to those that are not necessarily as nerd-like as we are.
Sure.
You for yourself, you had your machine and you let it sit there as a beautiful paperweight for a number of years before you decided, okay, I think it's time. I think this is something that I actually need to get myself into. So for those that aren't necessarily thinking that they want to nerd out, that they just need it for the basics, in sincerity things, do you believe that 3D printing is at the current situation that it is right now? Is it for them currently, or do they kind of need to sit back and wait?
I think you certainly the cost, comparatively speaking, to something like let's say that you're going to buy a full CEREC solution at $170,000. That's a tremendous commitment.
Yeah.
While 3D printers aren't cheap, they're not that kind of money. So what you're getting into is, let's say that, hey, I don't want to design anything. I just want to print something and have it in my office. You still can save money doing that. The ROI might not be as quick, but you can still save money because even in scanning softwares, everything is going to AI so quickly that, like right now within 3Shape, you could take an upper and lower impression and send a night guard to be made with AI, and they send you back the STL and you print it. So you really don't have to do anything but take the information and then print, but you still have that control to be able to print it and have in your office within a short period of time. So you can be just as efficient, but you don't have to sit in front of the computer and nerd out on it.
Yeah.
So I do think that there's a value of having that. The question is, what level of printer might you need to do it? There's different levels of printers for what you're trying to do. Of course, the more intricate stuff like crowns and things, you need a better printer. The newest Sprint Ray printer prints at 35 microns accuracy. The optical panel they have on there is really nice. So you don't need that. I mean, you don't need the newest that thing, but at the same time, you can get involved, and it can be actually it's just a lot of fun to play with it. It's like, I showed my patient today, said, I want to see something 3D printed. So I showed her this surgical guide I was making for tomorrow. She's like, that is amazing. And she just marvels at it. She has no idea what she's looking at, but she enjoyed looking at it. And I think, patients do perceive that part that you're involved and you're getting involved with this and can increase and improve outcomes, which to
It's
me, guided surgery is improving outcomes.
Oh, absolutely. It's funny to me as you were saying that kind of stuff. What do I actually need my machine to do? Whenever I'm buying a new phone or I'm buying a new car or something along those lines, they've got all these different tiers of what level do I need to be
Yeah.
to, and it was kind of entertaining. My younger son, he came up to me and says, "Dad, I'd like to get a new iPhone." And I said, "Well, have you done some research on it?" He goes, "Yeah, there's this one that's 128 megs. There's this other one that's 256, one that's 512." He said, "I think I need the 512 just in case. Just in case I might need that little extra." It's like, dude, you don't need something like that. Are you kidding me? But for him, he's like, "Yeah, I think I need to." It's like, "All right, you're buying it yourself. Do whatever you're going to do. So be it." But at the same time, when we have something that comes back, the experience that that patient has, like the thing that you actually presented to them, they said, "I want to see something 3D printed." It makes me chuckle because there's been a few things like a digital denture that I had come out that was 3D printed. I looked at it, and for me personally, I mean, there was nothing there that actually made me think that this was a very aesthetic, very, very beautiful restoration or appliance to be able to be utilized. But when we showed it to the patient, they looked at it and they said, "That is the most beautiful thing that I have ever seen in my entire life."
Amazing.
It really was. It was like, "Do you need to put your glasses on first before you actually look at this? Because there's no way that you and I are looking at the exact same thing." But the perception of the patient that they had with this thing, they don't need the absolute maximum of what goes on as much as we think that we do. You said just a second ago, the ROI on these things, it just has to make sense for those that are kind of getting into this style.
Yeah.
Um, with you personally, did you start to market these things out for yourself and start to research them and say, this is the particulars that I need out of this, so this is the machine I'm going to start with? Or did you have one of those car buying experiences where you said, I just want it to be the best and I'll learn as I'm going?
No, I'll tell you that when I bought at the time I bought my Form Labs, it was the what I thought was the best printer out there, and it truly was. They were ahead of the game at that point. As a matter of fact, I can remember getting on Kickstarter and watching Sprint Ray as a company try to raise money for their Kickstarter campaign. This is 2015 approximately, and now I look at Sprint Ray, and I just went to their 3D Next meeting, and I'm looking around, I'm like, how did they go
From
from a
that to
Kickstarter
this.
to here? And they're showing, and they actually showed the newest printer. So and that for me, part of it was I went there and I was already involved at that point, but I knew that they were dental only. So they focused on our profession and said, we're just going to focus on dentistry. I knew they had 50 resin engineers. They're working on products. And I saw a lot of dedication within their company to what we're doing. And
Mhm.
as a result, I knew that kind of company is going to figure it out a little faster than others. And so even their newest printer, so I just got the newest printer that's coming out. One of the biggest issues with 3D printing is the fact that the fluidity of the resin has to be fluid enough that the build platform can go down and up into it and be fluid enough that it can actually print it. So the limitation was viscosity of the material. So they created a new stereolithographic printer that's a totally different type of 3D printer called Midas, and it has two vials and they're connected on the bottom of the glass sleeve. And so if you put pressure on this vial, this one raises up. So what that allowed them to do, because they can use a little arm and they can push on the first vial, is they can use a much more viscous fluid and pass it through that mechanism. And when they do, they can print layer by layer. Well, the thing that opens up, and this has been one of the challenges, is higher filler rate for the resin-based material. So what you're going to begin to see is a higher filler rate, and with that comes better mechanical properties.
Sure.
So that's what we're seeing is an evolution of those materials, and I think that's exciting. They're on the forefront of that. So I've been very happy with the fact that I feel like while there's a lot of companies that do this and that do it well, I feel like that company is dedicated to it, and I feel I can get behind it that they're moving for our customer experience to be even better. And I thought that was important to me.
Beautiful. So we've talked about the positives out of this. For a moment, negatives. What have you seen out of 3D printing that you thought we're just not quite there yet? Because I know that there's been the speed, the machines themselves at times can be tedious to actually have to deal with and clean up and switch materials and all that kind of dynamics that go with it. Sometimes even the smell can be a dynamic of what kind of turns people off of this. What negatives have you seen in 3D printing?
I think in general, it's a little bit of a messy ordeal. When you're 3D printing, you're going to be working with liquid resin and manipulating that and the build platforms. It's not that big a deal, but it's something you have to clean up, and it takes a little time to work with and with the alcohol. So there's some chemical nature of what you're doing. That's a little bit of a challenge. I think the other challenge is the printers work really well, and they're pretty bulletproof in terms of their workability. But I think it's still this perception that the printer's the element, and I think it's actually the design that's the bigger piece. So I think for me, the printing aspect's been pretty darn nice. I will say that I'm still trying to figure out. I'm doing some tests in my office to decide. So I'm taking the upper and lower models, CR records, and I'm actually printing those models and mounting them. And then I'm having AI and a lab and myself make night guards to try to see variability. So one of the challenges is going through this process to figure out the best way to do things. Am I doing anything better or worse than who's doing it the best, to try to figure out, where do I want to do this? So for example, if every time I made a night guard, the lab is better, then why am I making night guards, or I better learn what they're doing?
Sure.
Or if AI is better than both of us, then I understand that. So I'm trying to figure these things out. And part of that is it's just time consuming. So now, from a guy like me who likes and enjoys dentistry, I don't have a golf game. I don't have, so I like to do this stuff to figure out where we're going to go and what the best option is. But if I had a lot of extracurricular things pulling at me, and my kids are in college, so if I had extracurricular things pulling at me, it might be hard to devote the time to some of this. And I
Sure.
just have the time now. So I kind of like it. It's my fun thing to play with.
No.
So my negatives would be just the fact that working with it is sometimes it's a little time consuming to work with the resin but once you get the hang of it, it's not really that challenging.
No. I've been entertained to see that a lot of people, when we start talking ROIs with things, a lot of people just assume it's the financial dynamic that goes into it, and that's not the case at all.
Yeah.
I mean, yes, there is a financial piece to this, but the amount of time that it takes to actually get yourself up to being efficient with it, that has to be included into your overall dynamic of what am I thinking to myself of, does this have a truly positive ROI for me? Uh, it's it's difficult for people to actually understand that. So let's play here for just a second, Adam, just for the fun of this. I've never seen 3D printing before in my entire life. You've got a minute to tell me why it is that I need to get into 3D printing. Ready, go.
Okay, so the reason I would tell you to get into 3D printing is because in your office, you have something that you can take data from all around the world and print it out. So whatever you need to make can be made somewhere else and then allow you to print it in your office to make your office more efficient and can do it very fast. And if you really like it, you can play with it in your own office and control outcomes yourself. You don't have to, but you can. So it allows you to bring solutions quicker to patients. Let's say, for example, patient walks into your office today and they need a bleaching, they want to do bleaching and they need to make trays. How long does that take you normally to make models and then make the trays? Well, today I can scan you before you sit down for your hygiene visit. I can have those retainer slash bleach trays made by the time you walk out. And now what's the ROI on that? So all of a sudden you start thinking with a bigger lens about how I can do something, why they wait while they're here, while they want it, versus come back, let's sit down for another appointment, let's waste time for another appointment to do this. So the ROI, I think, is certainly there if you utilize it the right way.
Yeah, a lot of it sounds like it's patient experience as well with this kind of thing.
Absolutely.
More convenient for you, but patient experience itself. So that's kind of the what's and the hows and things, but there's other dynamics to this, and it's how we actually deal with our patients. Adam, I actually want to bring you back in. I want to talk to you a little bit about how it is that we do things and truly the why it is that we do what it is that we do with this kind of thing and how it can actually be associated in to to really improving the patient experience itself. So I'm going to bring you back on if that's okay with you.
Absolutely. Love to do it. I
That's
really enjoyed it.
fantastic. And for those that are listening in, as Dental Advisor is known for actually going through and doing evaluations for a number of these companies and a number of these different materials and equipment and things like that. If you'd like, go to the website dentaladvisor.com and take a look and see what things we've actually already evaluated for some of these companies and see if it's something that you kind of want to get into. But for all of us at Dental Advisor, and again, Dr. Hodges, thank you for joining us. My name is Dr. Ashton Prince, and we will see you next time.